Your ophthalmologist may recommend a procedure called a selective laser trabeculoplasty to treat glaucoma. In glaucoma, there is a progressive degeneration of the optic nerve over time, and the one variable that we can control is the eye pressure. For controlling eye pressure, there's really two things that we can do. We can either reduce the production of fluid in the eye, or we can increase the outflow of fluid out of the eye. So the fluid that's produced in the eye, called the aqueous humor, is produced in an area called the ciliary body. It flows in front of the lens through the pupil. It circulates in the anterior chamber, the front part of the eye, in between the iris and the cornea, and then it drains out for 360 degrees to this sort of filter material called trabecular meshwork into collecting channels called the canals of Schlemm, and ultimately into the bloodstream. To reduce the pressures, we can either use eye drops that are basically repurposed blood pressure medicines, things like timolol, dorzolamide, and bromonidine, to reduce the production of fluid from the ciliary body, or we can increase the outflow of fluid from the eye. Sometimes we use eye drops like latanoprost and travoprost, or in this case, we're talking about a selective laser trabeculoplasty. And with a selective laser trabeculoplasty, we place a lens on the eye after numbing the eye up, and we use a special mirror in the lens called a gonio lens. It's kind of like a little periscope that allows us to see this trabecular meshwork. Otherwise, it wouldn't be visible looking straight into the eye. And what we do is we shine this laser on the trabecular meshwork, and we do a number of spots. It probably averages between about 60 and 100 spots in the eye. And it doesn't actually cut a hole in the trabecular meshwork, as you might imagine would occur with a laser. What this particular laser does is it focuses the energy on the trabecular meshwork, and it creates some low-grade inflammation that over time causes the trabecular meshwork to become more permeable so the fluid can drain out more rapidly. And of course, there's no such thing in medicine as risk-free or pain-free surgical procedures. In general, this is not a particularly uncomfortable procedure, although occasionally patients will mention that one or two of the shots are uncomfortable. And of course, having the lens on the eye is a little bit irritating. In general, the procedure takes less than 5 minutes, so it's not a very long period of time that the patient has to sit still with a lens on their eye. And of course, we numb up the surface of the eye prior to placing the lens on the eye. Other risks of the procedure, other than discomfort, include inflammation in the eye and corneal swelling, as well as increased intraocular pressure spikes that can sometimes occur. Almost invariably, we put in some drops to try to minimize the risk of an acute pressure spike shortly after the procedure. And frequently, medicines that are similar to topical Advil are used on the eye to minimize inflammation and discomfort postoperatively. In most patients, the maximum pressure decrease will occur in approximately 6 to 8 weeks. So I hope this short video gives you some useful information about a selective laser trabeculoplasty and some of the reasons that your physician might wish to elect to recommend this as a treatment option.